नमस्कार मित्रांनो, मी डॉक्टर योगेश शिंदे, IVF specialist working in Me and Mummy Hospital. Since last 10 to 12 years I am here, mainly dealing with the patients who are having infertility problem. So actually when we are saying this is an infertility case, so when we call this as an infertility case, actually when patient or when couple is trying since last 1 year and still then also if they are not having success or a positive result or a conception, then it's an infertility. After taking treatment also, if they are not getting pregnancy after 2 years of their treatment, then it's an infertility case. So most of the couple, they are very worried about this case because this is a social problem. This becomes a social problem. So most of the time they are very reluctant to take treatment because again maybe because of money problem or maybe because of social stigma. So always we should know about this, why actually this happens, why they are not getting conception in the right time. So before going into that, we should know what are the reasons for this infertility. So actually when we are saying a couple is having infertility problem, then first thing we have to deal with the reasons. What are the different reasons, what are the different factors which causes infertility. So if you see in a female patient, what are the different factors. So factors may be, so suppose this is a case with a infertility and they are having married life or marital life of 2 years and still they are not having children. So this is the uterus. On the both sides there are fallopian tube, one fallopian tube on the right side, second on the left side, 2 ovaries, one on the either side. So if you see a physiological process for a pregnancy, for the conception, so during her menstrual cycle, folliculogenesis starts from the day 2 of the cycle and that follicle becomes mature when day of the cycle reaches to 14. So that is approximately, not the perfect, but when it reaches to 14 or 16th day of the cycle, that follicle becomes mature and then that follicle ruptures and actual oocyte from that follicle, a mature M2 phase oocyte releases from that follicle and that oocyte gets into the tube. And if intercourse is there on that day, then these sperms, there are many sperms in that semen sample and these sperms migrate towards the uterus, inside the uterus and towards the tube and then inside the tube, and then the fertilization process occurs in the tube. When embryo gets formed, then that embryo gets migrated to the uterine cavity and gets implanted there. So this is the process. For this process what requires is the regular menstrual cycle, folliculogenesis, development of the follicle, and then good quality oocyte releases, good quality sperms which has a best motility and best number. And if this process happens, then conception occurs. And if you see a success rate in a normal case, with a normal all the factors, success rate is hardly 10%. That's why when a couple is trying since last 1 or 2 months, so success rate will be hardly 10-20% only. Cumulative pregnancy rate or success rate will be 10-20% only. That's why that time requires for conception. So that time is approximately 1 year. So after trying for 1 year also, if they are not getting for perfect conception, then we have to deal with the reasons why it is not occurring in the body. So there are many factors. If you see factors, so there can be some ovarian factor where folliculogenesis is not there. When follicle matures but it doesn't rupture, then also infertility occurs. If tubes are blocked, this oocyte cannot come into the uterine cavity. Second, if there are some factors in the uterus like a polyp, like a fibroid or any other uterine factor, then also pregnancy will not occur. Then a male factor. Male factor infertility means when count is less, when motility is hampered, then also fertilization will not occur. So all these factors we have to find out. So how to find out all those factors? Suppose if patient comes with a married life of 2 years, first thing what we have to do is to check some hormonal profile. So hormonal tests, which are the hormonal tests? What we can do is first thyroid profile. You can do fasting thyroid T3, T4 and TSH. Then hormonal assay, in that you can check some hormones, but what we feel it's not necessary. So necessary investigations are thyroid and prolactin. Then comes a tubal testing. So chromoperturbation or a tubal testing is done on day 8 of the cycle. A natural cycle is followed. Sonographically you can see whether follicle is there, follicle is developing or not, whether it is rupturing or not, and how is the after rupture, how is the luteal phase, that is the last 14 days of the cycle. How is the endometrium, is there any uterine factor? So sonography is needed. First thing is hormonal thyroid prolactin, second sonography. If you are doing a scan or sonography and if it is preferably done on the day 2 of the cycle, it's good, because on day 2 we can check antral follicular count, that is called as a reserve testing marker. So how much is the reserve? That varies with the patient to patient, because reserve is important, that you can say as a stock. Because stock, why it is important? Because this is actually a oocyte reserve, and that lasts for their lifetime, their menstrual life. When a hormonal assay, after this, in a male factor, you can check husband semen analysis. In that you have to see how much is the count, how is the morphology, how is the motility, and some other factors also. So these are the basic tests you have to do. For this tubal testing, you can have two types of different tests. One is HSG and second is saline sonography. HSG is quite painful, but saline sonography is actually better for patient. Why? Because it is not so painful compared to HSG, and both are used to detect chromal to check the tubal patency. So after investigations are done, then you have to deal with the problem. That means you have to treat that cause. So with treatment you can deal with all types of causes, and then pregnancy will be there definitely. So always remember, whenever you have a problem, consult your physician and get your problems solved with a proper consultation or proper advice. So nothing to worry in this, but always go for a cause, find out the problems, treat that problem, and then definitely pregnancy will be there. So that's it, my friends. Always remember, whenever you are taking a treatment for infertility, don't get frustrated, don't get depressed with the long duration of treatment and the cost. Definitely cost will be there, because it is a little bit costly, because hormones are costly. But stick to your treatment. Proper guidance is important, and always have a proper healthy diet and exercise with your medical management. Pregnancy will be there. Thank you, friends.